At the end of 2011, this was a regional crisis affecting 5 planned countries, primarily Niger, but also Burkina Faso, Cameroon, Mali, and Senegal. Children under 5 and pregnant and/or lactating women were at an elevated risk from moderate or severe acute malnutrition. In March 2012, at the height of the food insecurity, there was a coup in Mali. Numerous armed insurgents took advantage of the political instability. Fighting increased in the north of Mali, which set off a large-scale population movement in and out of the country. The armed insurgent groups took hold across northern Mali, installing extreme forms of Sharia Islamic law. On the 11th of January 2013, the government of Mali appealed for international assistance. French troops began airstrikes against the armed insurgents and deployed special forces to protect Bamako. Thousands of civilians have fled, seeking safety, some now displaced for the second time in less than a year. On the 15th of March 2013, more than 447,000 people were displaced, 51% of which were children. Over 250,000 are internally displaced, and the remainder have fled to neighbouring countries, such as Niger and Burkina Faso. In Mali, internally displaced people are taking shelter with friends or families in private homes, living in extremely crowded conditions. Local services, including education and health, are overwhelmed. This is a slow-onset food insecurity, with a sudden crisis, military coup, and political unrest. Plan has been responding to the food crisis through its regular development program since 2011. Operations stepped up in 2012, with increased grants and partnerships. Plan is responding to the Mali conflict by providing dignity kits, including a bag, soap, sanitary items for women, clothes, toothbrushes and toothpaste, bed sheets and mosquito nets, and headscarves for women. Hot school meals, food, shelter, water, sanitation, catch-up classes, psychosocial support and protection are also given to children and their families. However, security has been an ever-present concern. Operations have been delayed from time to time to ensure the safety of relief staff and beneficiaries. Plan believes that no matter where children are located, small remote villages or refugee camps, the education they receive will stay with them throughout their lives. In Mali, Umu and Minti, displaced children, are benefiting from catch-up lessons to ensure that they don't fall behind. We came with no luggage, no clothes, and without our notebooks. Plan made sure we had what we needed to attend school and feel confident. My teacher praised my work in maths. I feel happy with my studies. I love this school, they said. Displaced students are showing significant improvement thanks to the catch-up courses. The last monthly assessments show an 80% pass rate. Plan's unconditional and non-negotiable position is that all children must attend school. There must be equal opportunity. Plan knows from experience that in an emergency situation, children's risk of abuse, sexual violence, early or forced marriage, and trafficking grows significantly. However, child protection is a low priority for donors during emergencies. Without adequate funding, providing support for needy children, particularly adolescent girls, is a big challenge. In Tuareg culture, for example, early marriage is seen as a mechanism to prevent girls from having sex outside of marriage. Doing so, or falling pregnant, is regarded as a sin. There are numerous health, social welfare, and economic reasons as to why early marriage is a bad practice. To open discussion on this taboo subject, Plan has set up peer mentoring groups, comprising young people from the community. These groups engage parents on the negative impact of early marriage, which denies children the opportunity to complete their education and can endanger their health through early pregnancy. They discuss and consider how an education can lift their daughters and their future children out of poverty, that learning to read can be life-saving, such as reading labels on medicines, or empowering women to run their own businesses to provide for their families. In Burkina, Plan is setting up child-friendly spaces in the camps where children can have their own safe place to be children, playing and enjoying a real childhood. They are provided with meals and taught about hygiene, sanitation, and how to recognize dangerous situations. By supporting the refugees, giving them hope, and reinforcing their self-esteem through activities and training, Plan helps them to build new lives and prepare to return to their real homes. Agachatu left with her 3 girls and son to seek the safety and refuge of the Taberi camp in Niger. For the past 4 months, I've been quite happy here with my children. Education helps to completely forget what they went through. My children have received toys, textbooks, clothes, and the school canteen helps especially, providing daily food rations, which school children did not have before. I prefer the life I live here to the violence and uncertainty we left, she said. Plan's budget for the emergency response is estimated to be $25 million across all 3 countries involved. These vital life-saving programs are only possible with financial support.